welcome to the Medical Report podcast, where we bring health to your ears. We are your hosts, Zenzele, Olu, and I am Anita. This podcast is brought to you by our sponsors, Interval Care Medical Services, New Life Rehab, Graceful Hands Rehab, and Bantu Cola. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an adequate means to diagnose or treat you. We recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. Or if you'd like an assessment by one of us here on the panel, you can reach out through our social media pages. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your questions in the chat and we'll answer it in our Q&A segment later in the show. If you're watching this after our live show ends, feel free to ask your questions in the comments as well. Also, be sure to like and share this video. We want to feel the love. All right. So how's everyone feeling today? How's your week been?
Pretty good, I would say.
It's Olu, what'd you say?
I said pretty good, I would say. Nothing too eventful over here.
Nothing too eventful.
Yeah.
Zenzele?
I've been working out, going to the gym,
Okay.
spending more time in the sauna than the weights, but it's all good.
Hey, you in there, right? It's progress. Yep. I've been pretty busy, just kind of all over, but life is life. Life is crazy, but it's all good. All right, so today our topic is about MS, which is multiple sclerosis. It's an inflammatory disease that attacks the myelinated axons in the central nervous system. In other words, it's a disease that attacks the nerves in the body to variable degree, and that causes physical disability over time in more than 30% of people that have MS. This decline generally occurs over 20 to 25 years, and the hallmark of MS is symptomatic episodes that last at least 24 hours and happen months or years apart, and they affect different parts of your body. Classic symptoms and signs of MS may last days to weeks. Like we said, there's episodes that occur. So early signs are usually sensory loss, like feeling tingling, what we call paresthesias. Fatigue, which happens in 70% of people, dizziness, muscle cramping that are caused by muscle spasms, and progressive muscle weakness. Patient may also have changes in their ability to control their bladder and bowel functions or problems with sexual dysfunction. They may have facial weakness or trigeminal neuralgia, which is like this pain coming through the side of the face, these nerve endings, kind of like painful sensations on your face. You may have some twitching of your facial muscles as well. Eye symptoms may be diplopia, which is double vision. So that usually happens on lateral gaze. So if a patient's looking more to the left or right, then they'll get that double vision that occurs. And 33% of patients with MS have this. They may have heat intolerance or pain. Pain is definitely one of the major ones that happen in 30 to 50% of patients as well at some point in their illness. And cognitively, there are changes in their attention span, concentration, memory, and their judgment. And they also may have changes in their speech. Psychologically, patients can also experience depression, bipolar disorder, or dementia. And dementia is usually one of those late findings, or sometimes it can be found on initial diagnosis if it's later in life. Overall, MS can affect all different parts of your body. It's diagnosed usually with an MRI of the brain, where they're usually looking for lesions on the brain, and that's also how they monitor your disease progression. If they're not able to confirm the MRI diagnosis with an MRI, they usually will do a cerebral spinal fluid tap, where they'll look at that and look at the pathology of the fluid in your spine. They also have evoked potential is what they use, where they target specific nerve pathways and they stimulate them. And so when they do that, they kind of see what's working and what's not working. And the treatment overall can be very complicated for MS, but usually it's best managed by a neurologist and your primary care physician. So definitely get specialty involved. It's treated with immunomodulatory therapy, or IMT, for the disorder. It can consist of steroids and plasma exchange, or for the acute attacks that are experienced with MS, But those that have the relapsing or recurring attacks, they're usually treated with interferon or monoclonal antibodies and other medications specifically for the symptoms they may be experiencing at the time. So, a big point for all of this is early intervention is key. So, those that begin having symptoms, make sure that you're going to get checked out by your PCP and maybe kind of direct those things. So, from a speech therapy and physical therapy standpoint, guys, what have you guys seen and experienced?
Oh,
Denzel.
Lou, you got it.
Oh, I was going to say ladies first, but I'll, I'll go first. Well, from a PT perspective, um, MS is kind of, I mean, I would say it's on a spectrum. There are high level MS patients who will have moderate symptoms where maybe they can't really grip things with their hands. Maybe they have, slight gait impairments. Then you have people all the way on the other end who are,
Gate.
yeah, to the point where they can't walk at all. I've had an MS
Mhm.
patient who couldn't move anything from the waist down. I've also had an MS patient who could move around and play sports. So
Oh,
it really depends on what part of the brain is affected and how advanced in their MS um, that they are, and then really which type of MS that they have. I think relapsing remitting is the most common one. That's like
Mhm.
80%. That's where it kind of comes and goes. There's
Yep.
another type where it comes and goes, but that coming part doesn't really happen for like a long time. So you might go years without having MS symptoms. So each person is going to be kind of different and in how you target it as a physical therapist. So that's really my 2 cents.
yeah. For me, it's a lot of different areas. So they have cognitive issues. So that would be like memory, judgment, reasoning, all of those things. And so basically, as a speech pathologist, what I do is I work on compensatory strategies. Okay, so if you're having a problem with your memory, let's say, you can't remember how to get somewhere. Well, I have to create some type of strategy to help you to figure out how to get to the doctor's office. You have difficulty remembering telephone numbers. So I might do a treatment in which we take the numbers and we chunk them into individuals and learn how to be able to uh, retain that information in your head so that you can continue retaining telephone numbers, things like that. Judgment, reasoning, it's a little bit more involved. But those are some of the cognitive issues that you can run into. But primarily, you're looking at dysphagia, which is the difficulty swallowing. Okay. And that can happen let's see, real quick, like a fact. The National Multiple Sclerosis states that dysphagia is estimated in 1/3 of patients with MS. So it's not uncommon. And basically, a few things can happen. You can have a lot of times when people say it feels like the food got stuck, right? So that would be considered like airway obstruction. So, or they'll say if food is getting stuck in my chest, well, then that would be esophageal, where your esophagus is at. So, all along that pathway, I have to work on trying to figure out one, locate where it is, and then two, what the dysfunction is, and then we can treat it from there. Uh, Dysphagia also can end up with the food entering your lungs because you're aspirating. So every time you cough, that's what we consider aspiration to be. So you can throat clear like that. That's a minor form of dysphagia, all the way up to choking. And your food textures, unfortunately, may have to be altered as the MS progresses. So you might be able to eat a piece of chicken right now, and maybe a couple years from now, that chicken might need to be cut up into small pieces, and you have to chew it well. And then, let's say years later after that, unfortunately, and this does not happen to everyone, but it is a possibility as it progresses, and that's that the food may have to be pureed just so that you're able to swallow it better. So there's different, like you were saying, Olu, there's different stages. So it just depends on where someone's at as to what type of treatment that they get.
Yeah. I would going back to physical therapy. One of the things I remember from school, the biggest things are what not to do with MS patients. You don't
Okay.
want to fatigue them because you can actually advance their disease. And then you also want to stay away from heat because that's also not good for them. So as far as activities and exercises, you don't really want to do anything outside in the heat here in the DC area. I'm sure it's like 97 right now.
Yeah.
It's been well over 95 for like the past few days. You don't want to do
Oh,
anything
that's
outside.
you live in.
Yeah.
That's right. You living in a nice place. Yeah, you got a
95
nice
is
spot
hot
you
for
living
here.
in.
I guess it's humid here though, and that's exactly the type of weather that you don't want to do anything. You know, if you're an MS, someone with MS, you don't want
Mm.
to do anything in hot, humid weather. You don't want to be extremely fatigued. Um,
So you trying to say
one-
folks can't move to nice spots?
I mean, they can move to nice spots, but keep your stuff indoors and take breaks and drink water. So when I
Yeah.
Maybe
had,
even just considering the time of the day, even if they
yeah,
were to go outside.
exactly. So you don't want to just, you know, I mean, honestly, I just tell people who have MS, just take it easy. You want to do everything in moderation. You don't want to overwork yourself because you could make
Right.
it worse.
Mm-hmm.
Yeah.
Yeah.
So a climate controlled environment and chill. I like that.
I've actually heard of people moving to more like better climates for them because they had MS.
I mean, I know
Wow.
people in general that don't have MS that do that. I mean, especially elderly. I know some people that would move. They have homes in like
Yeah.
Tucson, Arizona, where there's like no humidity, but it's
Yeah.
hot during certain times of the day, so you avoid it. But they don't want to live in the cold all year round, so they'll move to a warmer place
Right.
during the
Any kind of neurological, with your arthritis, things like that. If you've got it, dominant in your body, yeah, you don't want to live in the cold.
Yeah. I've heard San
Mm-mm.
Diego is a good place to live.
where?
What's
San
his good
Diego,
spot?
San Diego.
Oh no,
It's
I'm
not
good.
too hot. It's not too cold. Am I
I thought
wrong?
it was a little muggy when I went.
Oh, I've never been. Maybe you went
Whenever
at
when I
a
remember
bad
Sandy, but I
time.
went during the summer, so
LA was too popping for me. LA
San
Diego is
Francisco, it's like cold in the morning, then it gets hot in the
Yeah.
afternoon. It's like sweater weather in the morning,
As long as it's
mm,
not that hot, muggy Florida weather.
right?
Yeah,
Yeah,
definitely
Florida is.
don't live in Florida if you got MS.
right, right. Well, I'm in California, so it ain't not much. At least our weather's dry. We don't have the humidity,
Yeah,
so come on through. Gotta come to Cali.
yeah. I missed Cali because my hair would be nice and never puffed out. All like when I'm in
Uh,
Florida, it's the opposite. It's like,
right.
oof,
Yep.
yeah.
Speaking of Cali, um, I guess we are going to talk about medical cannabis.
Hmm.
But yeah,
Yes, that will be one of our topics. You guys, stay tuned. We are working on that medical
yeah,
cannabis.
I have heard that some people use that to help themselves with MS to relax and kind of slow down a lot of those symptoms,
Muscle spasms,
muscle
especially.
spasms, the spasticity, and just in general, just de-stressing and keeping calm and less fatigued. I don't know
Right.
anything about that.
I
I'm
did see one of the symptoms being depression too, though. So
Yeah.
that might help. It might
exactly.
help. We're not telling you to go smoke tree. We just saying.
Look, you know what? Look up Montel. Montel Williams is a big advocate for it.
Yeah. Honestly,
Um,
he was the first person that I can remember that was like really like heavy hitting to the public about speaking on cannabis and how
Right.
it's helped
he
him
was
in his
the
health.
first person I heard actually speak about MS. I didn't even know about it until he said something. This back in high school for me.
Yeah.
Yeah.
But at that time, it was still taboo. I think only until now, and I think so many more people are doing it than people realize. So
Mhm.
yeah,
Yeah.
All right. So if you guys have any questions or throw them our way, we will answer them as we go.
Hmm.
One thing I was also looking at when I was looking at the symptoms is I was also looking at breathing problems. So, breathing problems is another one that they have. And a lot of people probably don't associate speech with breathing, but it goes hand in hand. You need that breath support to get your voice out. So,
Right.
if you can't breathe well, you can't speak well. So, you might need some type of voice training to, at whatever stage that it occurs, it might be an option.
I mean, I saw it said also, cognitively it's affecting people like with their memory and things like that as well. Speech therapy also does cognitive training as well, correct? So,
Right. Yeah. So that's what I
what
was
are good
mentioning in
exercises
the
for that?
beginning. The cognitive, a lot of people when they see the word cognitive, they think psychiatric. So I always have to tell folks, I was like, you could have been crazy when I met you. You're gonna be crazy when you leave. So that has nothing to do with what I do. I do not. I'm not a psychiatrist, psychologist. I am, like Olu knows how it is. I am a counselor at times, though. All three of us. We
Yeah.
spent a lot of time counseling people, and we took counseling in our grad course. I'm sure you may have as well, and it's just part and parcel. People are going through a serious medical condition, and they need someone to talk to, and usually the person you're with or your therapist you're with all day, your doctor, your therapist, and end up being quasi semi counselors sometimes. But when it comes to cognition, it's just finding strategies for you to be able to function in your activities of daily living.
Yeah.
That's it. You
Thinking back
know,
to one of the MS patients that I had, half of our sessions were just us talking about her disease and coming to terms with kind of the progression. Um, and then maybe the other half was balance exercises and actual exercises. But I was just like, I, I didn't spend a ton of time in school on the mental health aspect of dealing with things like MS, but you have to learn fast in PT for not just MS and Parkinson's and a lot of the other neurological disorders. There's not too much we have right now that can mitigate them. So you have to be, like you said, a counselor to a lot of people. Uh, Chris had a question. What are some exercises that you typically use to help people with MS? So I'll answer that as the PT.
I can
Like,
give you some too in a minute.
yeah. So, like I said, it really depends on how that person presents. So, if I have a high level patient and I evaluate them and I see all they have is gait impairment, which is walking, and they have balance, then that's what I'm going to focus on. I'm going to give you balance exercises. I'm going to ask you to do things like tandem walking. Tandem walking is kind of, when, let's say, you get pulled over by the cops and they want to see if you're drunk, they have you do that test. That's where, you're walking heel toe. That's tandem walking. I might have you do some
I
things.
can't pass that now, Olu.
Yeah.
No
So,
drinking at all. I don't have any alcohol in my system, and I can't tandem walk.
Why can't you pass that?
but that's an exercise. It's not to see. I'm not. I always tell people I'm not trying to see if you're drunk. I'm actually trying to work on your balance here. I know that you can't do it, so don't
Right.
worry so much about actually being perfect. I might have you do things if balance is the issue. Maybe eyes open, eyes closed, because vision is also a part of your balance, and including that, your vestibular and your inner ear, and then obviously your proprioception, which is all over your body, your sensors all over your body. But I challenge you by have you do stuff with your eyes closed. If it's strengthening, that's really your main issue, then I'll just target those muscles, and then depending on if you're high level with MS or if you're low level with MS, that'll determine, am I going to give you lower level exercises where you're just laying in bed and we're doing simple exercises like that, or are we actually in honor of Chris? Are we
With
are
the
we
weight.
are we going to be actually lifting weights? And then I have to, like I said, I have to monitor as the PT. I can't, we can't, be bodybuilders and use extremely heavy weights. I have to use. My point isn't to make you huge and muscular. My point is to, you know, keep some of that strength that you have that you're losing and, you know, get you back to some place where you're functional and you can still walk around and move around and that sort of thing.
Right.
I'm not a personal trainer,
But I
And
basically.
mean,
you
even
know,
initially, I'm sure you're establishing with them what level of function they want to have before you get started, right? What their expectations are, basically.
Yeah, and most of the time they kind of know. I've never really had too many people with these neurological disorders that don't really understand how the progression is. They don't
right.
want to be big bodybuilders. They don't want to, go out here and squat 250, but they do want to be able to walk around and get up the stairs. And so
Yeah.
my goal as the PT is to take you to that point, be able to live your life,
Hmm.
um, not
Yeah,
to
for
be.
me, I get from a cognitive aspect, I usually get the same question from everyone, and that is, will I always be this way, or will I ever go back to, where I was before my prior level? And I always tell people the same thing, and whether it's MS or stroke or whatever, you are a new person, you have a new life. Thus, new life rehab. But you're a new person now. You're a new life. You have a different path now. And a lot of times people don't take the opportunity to grieve the person that they lost, because that is not the person that you will be going forward. And family members have to do the same thing. They're not the same person anymore. They have to give them space to grow now into this new person, this new life, this new, way of living. You were talking a little bit earlier about exercises, and you can prolong your swallowing problems if you're able to. There's one thing called effortful swallow, and all you're doing is, if you touch your Adam's apple and you basically swallow really hard, and so you take a sip of water, and then after you swallow that, you do a what we call a dry swallow and swallow really hard. And that's basically like doing, a curl or something like that, where you're pushing really hard. If you're able to swallow with nothing in your mouth, just your saliva, within 3 to 4 seconds, and you can do that 4 or 5 times in a row, you have a strong swallow. So that's a good way to judge it, so that you'll know. And it is not easy to swallow with nothing in your mouth. But when your swallow move towards 10 seconds, 12, 14 seconds, then you've got to start working on it. And as we get older, everyone has to work on their swallowing, because as the muscles on the outside of your body get weak, the muscles on the inside of your body get weak. It's just the way life is. You got wrinkles on the outside, wrinkles on the inside.
Yeah. I think even from like we have a question. So you can acquire MS. I thought it was something that you were born with or inherited via DNA. Yes, I mean, yes, it's something that you're basically born with. It's an immune response. So your body is reacting to kind of bringing it up to the forefront of your current situation. So you may have been born where nothing was wrong, and then eventually you begin to develop symptoms.
It
Um,
presents later in life.
It's autoimmune.
right.
So I've heard
So
actually, you can get a virus,
yeah,
something else, and then that can actually
it
cause the
activates. Yes.
body to do the overreaction and start to attack itself and demyelinate all of the areas in the brain that would cause it
Yeah.
to
Demyelinate.
demyelinate.
Which
Yes,
Word of
means
the day.
that
which means
your neurons in your body, or your nerves, have this myelinated sheaths. So basically it's like a myelin that covers, just think of like a slip cover over your nerves. So when
yep.
it's demyelinated, it means that it's exposing those nerves, and irritating them, making them have all of these symptoms that we're talking about now. So your nerves affect so many different things in your body. And so that's why there's so many different symptoms that person has.
I've always I've used
And
this
believe it or not,
example.
that's actually what causes the cognition issues, is the
Mhm,
loss of the myelinated sheath.
mhm.
Yeah, I've always used this kind of example. Like myelin is like the foil you use on like a to-go plate. If you don't cover the food,
Hey,
if you
that's
don't
a
cover
good
the
one.
food, then you can't eat it. So it's like it's the same thing. Myelin is the tinfoil of the brain. preserving your brain.
Yeah, you need that myelin.
Yeah.
All right, so that was our show for the day. We hope you'll tune in with us again in 2 weeks. We are working on a lot of good topics to come up. If you guys have any suggestions for us, please send them to us in our DM. Please connect with us on our business and social media pages at Bantu Cola, at Integral Care Med, at New Life Rehab, and at Graceful Hands Rehab. If you're watching our live session and it's ended, you can still leave questions in the comments. We'll get back to you. Let us know.
Yeah, holla.
What do you want to know about? But like I said, suggestions, leave them in the DM or comments as well. In the meantime, stay well until next time. We'll see you. Bye.
Love, peace, and hair
Bye.
grease.